Welcome to Food Safety 5, twice monthly reports from the Food Safety Magazine editorial desk to keep you abreast of top news stories and current events impacting the food safety sector. This episode discusses recent events at the U.S. Centers for Disease Control and Prevention, from firings to program cuts, and how these changes are impacting food safety work. First, in August, the news came to light that CDC had quietly slashed the number of foodborne pathogens surveilled under its Foodborne Diseases Active Surveillance Network, or FoodNet, surveillance program from 8 to 2. As of July 1st, surveillance under FoodNet, the only federal surveillance system that actively collects data for multiple foodborne diseases, only covers Shiga toxin-producing Escherichia coli, or STEC, and Salmonella. Prior to the cuts, FoodNet also included 6 additional pathogens that are significant to food safety and public health: Campylobacter, Cyclospora, Listeria monocytogenes, Shigella, Vibrio, and Yersinia. To contextualize the importance of some of these pathogens, according to CDC's latest estimates, which were informed in part by FoodNet data, Campylobacter alone caused 1.9 million cases of foodborne illness in the U.S. in 2019, beating out both Salmonella and STEC. Experts say that the cuts to FoodNet may compromise public health officials' ability to recognize when cases of illness related to a certain pathogen begin to rise, hindering foodborne illness outbreak response. Moreover, accurate analysis of trends over time may be impacted. CDC cites inadequate funding as the reason behind the FoodNet cuts and says its state health department partners that participate in FoodNet may continue to surveil the 6 nixed pathogens voluntarily. Whether the 10 state health departments that participate in FoodNet scale back their surveillance is yet to be seen, however, with some states saying that they will need to make cuts if federal funding for state public health activities continues to diminish as it has under the current presidential administration. Shortly after the news about FoodNet came to light, on August 27, the Trump-appointed CDC director Dr. Susan Monarez, who was just confirmed by the Senate in July, was fired from her role. Dr. Monarez's dismissal played out in a social media showdown on X, with the U.S. Department of Health and Human Services announcing in a post that she was no longer CDC director. This led to a series of posts by Dr. Monarez's attorneys alleging that she had not been officially notified of her termination, alongside statements that said, "When CDC Director Susan Monarez refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. For that, she has been targeted." Later that same night, the White House leveraged its authority to dismiss Dr. Monarez, with White House spokesperson Kush Desai issuing a statement that said, "Susan Monarez is not aligned with the president's agenda of making America healthy again, or MAHA. Since Susan Monarez refused to resign despite informing HHS leadership of her intent to do so, the White House has terminated Monarez from her position with CDC." According to sources close to the situation, Dr. Monarez's termination was triggered by clashes with HHS Secretary Kennedy, including disagreement over his stance on childhood vaccinations. Relevant to food safety, however, Dr. Monarez reportedly refused to fire 3 top CDC officials at Secretary Kennedy's behest, including Dan Jernigan, MD, director of the National Center for Emerging and Zoonotic Infectious Diseases, which is responsible for tracking foodborne illness outbreaks, zoonotic diseases, and antimicrobial resistance. Dr. Monarez was also urged, and refused, to fire Deborah Howry, MD, Chief Medical Officer and Deputy Director of Programs and Science, and Dimitri Daskalakis, MD, Director of the National Center for Immunization and Respiratory Diseases. After Dr. Monarez was fired, Drs. Jernigan, Howry, and Daskalakis all resigned from CDC. In Dr. Monarez's absence, Secretary Kennedy has appointed his second-in-command at HHS, Deputy Secretary Jim O'Neill, as acting director at CDC. Mr. O'Neill has no training in medicine or infectious disease science. The chaotic events at CDC have prompted thousands of public health professionals, representing dozens of stakeholder groups and federal agencies, to call for the resignation of Secretary Kennedy in 2 letters dated September 3rd. One of the letters, signed by 22 national medical, scientific, public health, and patient organizations, said that HHS's efforts under Secretary Kennedy to undermine science and public health definitively leaves Americans less safe in a multitude of ways, including food safety. The statement argues that, under Secretary Kennedy, the U.S. has been left with a reduced capacity to protect the public from foodborne illness, including a drastic reduction in the number of infections monitored and a resulting increased risk of foodborne illness. This is in addition to negative effects on diagnostic testing, disease surveillance, emergency response, and state and local health department capabilities, said the letter. A second letter, signed by more than 1,000 federal employees representing 14 public health agencies, including CDC and the U.S. Food and Drug Administration, also called for Secretary Kennedy's resignation, saying that he endangered the nation's health by facilitating the firing of Dr. Susan Monarez and causing the resignations of important CDC leaders, as well as appointing political ideologues who pose as scientific experts and manipulate data to fit predetermined conclusions, among other actions. Since the inauguration of President Trump and appointment of RFK Jr. as health secretary, the agency has been on the receiving end of significant workforce and budget cuts, including the dismissal of more than 2,000 staffers, causing unease among HHS employees and public health professionals nationwide. For more information on any of the stories mentioned in this video, be sure to check out the Food Safety Magazine coverage linked in the description. Check back twice monthly on Tuesdays for the latest Food Safety 5 episodes, available at food-safety.com or on our YouTube channel.